Good morning everyone. Today we are going to see about Alkaptonuria, an inborn error metabolism. So to begin with it all, what is inborn error metabolism? Inborn error metabolisms are something that occurs in our body due to genetical mutation by birth, or it could also occur at the time of certain trigger factors. So these generally actually occur due to certain problems occurring in the metabolism of fat, protein and carbohydrates, or in their storage. The symptoms usually leads to either acute or chronic encephalopathy. So this generally affects the brain function, and in most of the inborn error metabolism, all we see is that the affected person generally has some issues with their IQ levels or their intelligence or their psychomotor functions or every other things in between. So next is our topic is Alkaptonuria. So in this we are seeing this is actually a genetic disorder that prevents the body from fully breaking down the amino acid tyrosine and phenylalanine. So this phenylalanine and tyrosine conversion actually is very essential in our body, as this gets converted into melanin, dopamine, serotonin and many of such essential neurotransmitters and hormones that are essential in our body. So this Alkaptonuria is also called as black urine disease, since the telltale sign of this Alkaptonuria is the changing of color of your urine on standing, which could be black or dark brown in color. The prevalence although is 1 in 25,000, so it's not that everyone gets affected by this, it's a rare case scenario. So moving on into the pathophysiology, this tyrosine actually has to undergo its normal metabolic pathway, forming fumarate and acetoacetate. But due to some gene mutation, the enzyme homogenetate oxidase doesn't get synthesized in our body, and this leads to accumulation of homogenetate in our body, as in bones, joints, or generally in tissues and in blood. This leads to defective metabolic pathway. So the enzyme, this defective enzyme then leads to accumulation of homogenetate, which gets oxidized to their corresponding quinones, forming alkaptone, a compound called alkaptone, which is nothing but a polymer of the quinones formed by the homogenetate. This alkaptone pigment is actually black or brown in color. This leads to the color change in our urine, which is coke in color. So symptoms include, this has actually vast and variety of symptoms, and the most important thing is that not every person who is affected by the disease gets all the symptoms. It could vary from person to person. So ochronosis is the discoloration of the skin, as I have given in the picture. It derives its name from the term yellow ochre, the color yellow ochre, and this leads to accumulation of the pigmentation in your skin. It could occur in any part of your body. And then osteoarthritis, as I told you that the accumulation of this alkaptone in your bones and joints will be seen in Alkaptonuria. This there occurs issues with the movement of your joints, and there will be swelling as well as tenderness in the joints and all. Then you have back pain and stiffness, brown spots in the eye, as I have given you a picture, and then thickening of the ear cartilage. So this cartilage is actually a bit softer. The fiber over here is bit softer, but in case of Alkaptonuria, due to its accumulation, the cartilages also tends to become very harsh and rough. The deposits could lead to heart diseases and valve problems, as you see in the heart diseases, and kidney stones, prostate stones and bladder stones. Shortness of breath and difficulty in breathing also occurs to some extent in certain people when this gets accumulated in the lungs. So then the diagnosis. So the most common telltale diagnosis is that your urine turning into black or dark brown on its standing. Then you also get a positive result in ferric chloride and silver nitrate tests. Benedict's test that we simply use for qualitative analysis of sugar will also give you a positive result, since this alkaptone is a polymerase of the quinones. Next, coming to the treatment. So generally there are actually medicines and medications, but the diet portion is also very important in Alkaptonuria. So we give them low protein diet, the ones that are low in phenylalanine, as phenylalanine gets converted into tyrosine, and from there we have defect in the metabolic pathway. So we should avoid foods that are high in phenylalanine. Medication nitisinone is also recommended by a physician. Exercise for proper movement of your joints and bones is also essential. And then we can also give them painkillers in case of joint pains and swells in the body. So some of the foods to be included and excluded I have added. So generally the things that you should avoid are food that are rich in protein, like your daily eating meat, egg, all those things have to be avoided, whereas low protein foods as in fruits, vegetables could be included in abundant. So that's it for today's learning. Next class I will see you with something else. Thank you.